Hello, I'm Dr. Gloria Addo-Ayensu, Director of Health for Fairfax County. We know the expanding outbreak of respiratory illness caused by the novel coronavirus, now referred to as COVID-19, is worrisome to many in our community. Although the potential public health threat posed by this virus is high, both globally and to the United States, the immediate risk to most Americans remains low at this time. The public health system is taking a multi-layered approach to keep the virus from spreading in the community, including aggressive actions such as mandatory quarantine of travelers arriving from areas with substantial disease transmission. Every day, the health department works behind the scenes to protect the community from all kinds of infectious diseases. Public health measures like screening people for illness, keeping those who are ill away from others, and investigating cases when they occur are used to limit the spread of infections such as measles, tuberculosis, or meningitis. While the novel coronavirus is new, we're using these tested public health practices to keep it contained. There have been no confirmed cases of coronavirus in our region. However, if a person does become sick with the novel coronavirus in our county, the health department will ensure the patient is isolated and away from others, identify anyone who may be at risk from being in close contact with the patient, and then monitor those close contacts for symptoms of the disease. In preparation for the likelihood of community spread of COVID in Fairfax County, we are also working with county and community partners to review and adapt our pandemic response plans to the current situation in order to reduce the potential spread of the virus and mitigate the impact it might have on our community. Implementation of basic precautions of infection control and prevention, including staying home when ill and practicing respiratory and hand hygiene, will become increasingly important. Until a vaccine or specific treatment for COVID is available, prevention measures are likely to be non-pharmaceutical in nature and could include strategies such as social distancing, avoiding mass gatherings, temporarily closing schools or businesses, and implementing enhanced cleaning protocols. We need your help in preventing this novel coronavirus from spreading in our community. Routine use of the following everyday preventive measures will increase community resilience and readiness for responding to an outbreak. Stay home when you are sick with respiratory disease symptoms. Cover coughs and sneezes with a tissue, then throw it in the trash can. Wash hands often with soap and water for at least 20 seconds. And if soap and water are not readily available, use an alcohol-based hand sanitizer with 60 to 95% alcohol. Routinely clean frequently touch surfaces and objects. In addition, we ask that you pay attention to the CDC travel advisories and suspend non-essential travel to destinations where the risk of transmission is high. A list of destinations with travel notices is available on the CDC website. We also encourage individuals and families to review their own preparedness. Talk to your loved ones about how you would care for each other if you were to get sick, and make sure you have the proper supplies at home, such as thermometers, cold medicines, pain relievers, soap, or alcohol-based hand sanitizers, water, and fluid with electrolytes. Have a plan for childcare if schools or childcare programs close. Ask your employer about sick leave and telecommuting policies, and sign up for Fairfax Alerts to receive official emergency warnings and information. Misinformation about the coronavirus can create fear and hostility that hurts people and makes it harder to keep everyone healthy. We can fight stigma and help others by knowing the facts. For accurate information about this evolving situation, please visit our website, fairfaxcounty.gov/health or cdc.gov. Together, we can keep our community healthy and safe. Thank you.